Welcome back. In part one, we got into some really mind-blowing research about sleep. Now, we're going to shift gears from just understanding the problem to actually mastering the solution. So, if you're ready to take back your nights and really boost your health, you are in exactly the right place. Let's dive in. Right, so we saw how AI can basically decode your body's nightly health report, predicting your disease risk with just incredible accuracy, sometimes even better than blood tests. But here's the most important takeaway. This isn't about some scary, unavoidable future. It's about opportunity. Because unlike your genetics or your age, sleep is the one thing you can absolutely actively change, starting tonight. So, how do we do it? Well, we're going to follow a really clear path, like an ascending staircase to better sleep. We'll start by figuring out what the goal is. Then we'll define what healthy sleep really looks like. After that, we'll walk through a step-by-step action plan, learn when it's time to ask for help, and we'll finish up by reframing how you think about sleep, not as something that happens to you, but as a skill you can master. First things first, what are we even aiming for here? The research showed something totally fascinating. The true sign of healthy, restorative sleep isn't just about one thing, like getting enough deep sleep. It's all about how well all of our body systems are communicating and syncing up all night long. And this image just nails the concept. See on the left? That's healthy sleep. Your brain waves, your heart rhythm, your breathing, they're all in this beautiful, coordinated dance. But on the right, that's at-risk sleep. The systems are all out of sync. It's like the heart is acting awake while the brain is trying to sleep. This kind of internal chaos is what predicts future health problems. Our goal, plain and simple, is to get from the right side of this picture over to the left. See, a healthy night isn't just one long, flat line of being knocked out. It's this amazing journey through different stages, over and over again. You start off in light sleep. Then you drift into what we call stable, or N2 sleep. That's almost half your night, and it's absolutely critical for locking in memories. Then you hit the really good stuff, deep sleep. That's where your body does its physical repair work, and your brain literally cleans out waste. And finally, you get to REM sleep, which is essential for processing emotions and learning new skills. It's this complex, beautiful dance that happens every single night. And here's the thing. It's not just about one single metric. Healthy sleep really has 5 key dimensions. We all know about duration, that sweet spot of 7 to 9 hours. But just as important is continuity. Actually sleeping through the night. Waking up all the time shatters your sleep and stops you from getting to those deep, restorative stages. Then there's architecture, getting that right mix we just talked about. And these last two, they are huge. Regularity, keeping a consistent schedule, and timing, making sure your sleep is synced up with your body's own internal clock. Okay, now that we know what we're aiming for, let's get practical. We're going to walk through a proven 4-step framework you can use to start improving your sleep, step by step. You start with the basics, and you only move up if you need to. I want you to think about this like you're building a house. Step 1, sleep hygiene. That's your solid foundation. If the foundation alone isn't enough, you move to step 2, behavioral strategies. That's like putting up the walls that give your sleep structure. For tougher issues, step 3, structured therapies, are the specialized systems like your electrical and plumbing. And finally, step 4 is knowing exactly when it's time to call in the pro. All right, let's dive into step 1, the foundation. This is all about what experts call sleep hygiene. Basically, it means setting the stage and creating the perfect conditions for your brain and body to be able to fall asleep and stay asleep. Think of these as the absolute non-negotiables. And this slide right here, this explains a super common frustration. You've probably heard about sleep hygiene. Maybe you've even tried all the tips and nothing. It didn't work. Well, here's the deal. It is absolutely necessary. You just can't have good sleep without it. But for a lot of people with chronic issues, it's simply not enough on its own. It's the starting line, not the entire race. So what does this foundation actually look like? Well, it's built on these core ideas. Keeping a consistent schedule, and I mean really consistent, even on weekends, is probably the most powerful tool on this entire list. Then you have the classics, making your room cool, dark, and quiet. Creating a relaxing, screen-free wind-down routine to signal to your brain that it's time to power off. Getting some bright light first thing in the morning to set your body clock. And, of course, avoiding things like caffeine or alcohol too close to bedtime. But what if you've nailed the foundation? Your room is perfect, your schedule is solid, and you're still just staring at the ceiling at 2 a.m.? Well, that's when we move to step 2. This is less about your environment and more about actively changing your brain's learned habits and breaking those bad associations around sleep.
The star player here is a technique called stimulus control. Now, the idea behind it is actually pretty simple, but man, is it powerful. Think about it. If you spend hours every night lying in bed feeling frustrated and anxious about not sleeping, your brain learns a new, terrible rule. The bed is a place for frustration. This therapy is all about breaking that connection and reteaching your brain that the bed is for one thing and one thing only: sleep.
And here are the rules. They are very, very specific. First, only go to bed when you feel sleepy, not just when you're tired. If you find yourself still awake after, say, 20 minutes, you have to get out of bed. Go do something quiet and boring in another room with very low light. Only return to bed when you feel sleepy again. And this one is critical. You must stick to your fixed wake-up time, no matter how little you slept. This builds up that sleep pressure for the next night. Look, it sounds tough, and honestly, the first few nights can be. But it is incredibly effective because you are literally reconditioning your brain's response to your bed. Now, a really important part of this whole journey is knowing when you've hit a wall. These self-help strategies are incredibly powerful, but they aren't a magic bullet for everything. Sometimes the smartest and, frankly, the strongest thing you can do is recognize you've reached a crossroads and it's time to ask for directions from a professional. And here's the thing that might surprise you. When it comes to chronic insomnia, the first line of defense, the most recommended solutions, aren't medications. They're actually a whole toolkit of structured therapies that are designed to create real, lasting change because they get to the root cause of your sleep problems. Okay, so let's start with a really comprehensive approach. It's called cognitive behavioral therapy for insomnia, or you'll see it as CBT-I. Think of it as a structured, multi-week program that's designed to completely reset your entire relationship with sleep. Now, CBT-I is like a toolkit all by itself. It's got a few different parts that work together. There's stimulus control, which is all about retraining your brain to associate your bed with sleepiness, not wakefulness. There's something called sleep restriction, which sounds scary, but actually helps make your sleep deeper and more efficient. And a huge part is cognitive restructuring. That's where you learn to challenge all those anxious, unhelpful thoughts about sleep. It's all built on a solid foundation of good sleep hygiene and relaxation techniques. And does it work? Oh yeah, the results are pretty impressive. When you look at the research, people who complete these kinds of therapies are more than twice as likely to overcome their insomnia when you compare them to control groups. And this is the best part, the benefits actually last long term. But CBT-I isn't the only tool in the shed. There are other really effective specialized therapies that can zero in on the specific reason you're not sleeping. It's all about matching the right tool to your particular challenge. So you gotta ask yourself, what's really keeping you awake? If it's a racing mind, just full of anxiety and endless to-do lists, then something like mindfulness-based therapy can be a game changer for calming that mental noise. But if you feel it more in your body, like you're physically tense, your heart is pounding, then specific relaxation techniques like deep breathing or muscle relaxation are designed to tackle that kind of stress head-on. And hey, let's not forget one of the most accessible tools that we all have: exercise. Just getting about 150 minutes of moderate activity in a week, whether that's aerobics, yoga, whatever you like, is proven to seriously improve your sleep quality. So you see, the big takeaway here is that this is all about building a personalized toolkit. You can match a very specific therapy to your very specific challenge. Or, even better, you can combine these approaches to create a strategy that is tailor-made for you. And this really sums it all up perfectly. The key message is that there are multiple evidence-based options out there. The right choice really just depends on your specific pattern. Is your insomnia being driven by racing thoughts, physical tension, or maybe just old habits and lifestyle factors? But what happens if the self-help and the behavioral strategies just aren't enough? It is so important to know when it's time to escalate to step 4 and get professional help. Knowing the signs is the key to getting the right kind of care. This little framework here can help you figure out what to do. If your sleep issues are pretty mild and have been going on for less than 3 months, you're in the self-management zone. But if it's become chronic, we're talking 3 months or more, and it's really starting to impact your daily life, it's time to chat with your primary care doctor. And if the problems just won't go away or you have some specific red flags, a referral to a sleep specialist is definitely the right move.
Now, I want to be crystal clear about these. These are the signs that need immediate attention from a doctor. If you're experiencing any of these, please take it seriously. Loud, constant snoring, or if someone tells you stop breathing or gasp for air, that could be sleep apnea. If you have these irresistible urges to fall asleep during the day, that could be narcolepsy. And physically acting out your dreams can be a sign of a really serious underlying issue. Please don't just brush these off. They require a medical diagnosis from a specialist. All right, before we wrap up, let's just quickly touch on a few special cases, because these strategies are not one size fits all and can be tweaked for different situations.
If you're dealing with chronic pain, listen up. Improving your sleep can actually reduce how intense your pain feels. For older adults, it's true that deep sleep tends to decline, but these therapies are still incredibly effective and safe. And for all the shift workers out there, the game is all about strategic light exposure and fighting for every bit of schedule consistency you can get. So, let's wrap all of this up with what I think is the most empowering idea of all. Sleep is not just something that happens to you. It is a skill. It's something you can practice, you can develop, and you can get better at over time with the right mindset and the right tools. So as we close out, let's just quickly recap the big ideas. Start with that foundation and work your way up the steps. Focus on consistency, not perfection. And please be patient with yourself. Real change takes weeks, not just a couple of nights. Remember that proven therapies like CBT-I are out there and they really work. And finally, know the signs that tell you it's time to call in a professional. I really want you to leave with this thought. Your body's nightly health broadcast can change. By treating sleep like a skill you can learn, you can shift from a pattern that predicts disease to one that actively builds your health, your resilience, and your energy. It is truly one of the most powerful things you can do for your long-term well-being.